Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balata from Roots Community Health Center, reporting for the week of October 2nd, 2023. After a COVID status update, I'll discuss what's new with COVID tests at this point in the pandemic. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. COVID is still with us. It is still causing sickness, disability, and death, and there's still a lot we don't know. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Starting off with our earliest indicator of how we're doing in the pandemic, taking a look at wastewater. This graph shows the percentage of sites across the country that have increasing or decreasing levels of SARS-CoV-2. And if you look all the way over to the right, just before you get to the shaded gray area, you can see a nice little decrease there. And that is as of September 11th. One thing I like about this is that as of September 11th, there were over 1,400 sites reporting, where it's been mostly in the 1,300s for the last couple of months. So it is good to see more wastewater sites reporting. The incomplete data in the gray looks like it goes further down before it heads back up, but since it's incomplete, we won't know for another couple of weeks what's really happening. So this data, unfortunately, is still lagging behind. And when we look at sites across the country, it really is all over the place. Some are going up, some are going down. So if this is of interest to you, you'll want to find the sewer shed closest to you to get a better sense of what's going on in your area. And hopefully it is much more current than what we're seeing on this nationwide, which is again a few weeks old. But on this point, I thought I would share this news article, which made me feel kind of optimistic. This was about a couple of hospital networks in Ontario, Canada, stating that they are reinstating masks in their hospital networks in response to increases in wastewater signals across the province. And if you're going to be removing masks and reinstating them, which I don't think is a good idea in healthcare, as you all know, I'm a firm believer that we should continue masking in healthcare and protecting our patients as we're continuing to do at Roots Community Health Center. But if you're going to take them away and bring them back, then bring them back in response to an early indicator like wastewater. This makes a whole lot more sense than what we're unfortunately seeing all across the country, where a number of hospitals are scrambling to reinstate masks because they have too many staff out sick or because they're having outbreaks in their facilities. And we've been looking at all of these different graphs for long enough to know that if you wait until you have high hospitalizations to put in place measures, you're too late for prevention. Your prevention should have been implemented a long time ago before you got to that point of increased hospitalizations, because we know that that is a late indicator. So this is just a continued frustration to watch over and over and over again. And the most protective thing to do would be to just keep masks in healthcare all the time. But I guess the second best thing to do is reinstate them as soon as you see wastewater levels going up, because especially if this is being reported frequently or up to date, then this would actually precede positive cases, positive tests. So you really just might be able to make a difference there. And in that case, if you're going to be doing that, it shouldn't just be hospitals, but also schools and other venues where a lot of mixing takes place. So I am hopeful that other parts of the world, including here in the United States, will take note of this practice from Ontario, Canada. And now taking a look at percent positivity. And this is continuing to turn down, now at 12.7%. That's as of September 16th. And this is based on over 71,000 tests. So it's interesting that the number of tests being done seems to keep increasing, because for most of July and August, the number of weekly tests was in the 40,000s. And then it went up to 50 to 60,000 per week for August. And so far in September, we've been in the 70,000 range. So the more testing being done, the better indicator this should be. although this is, of course, reliant upon testing behavior, so it's not necessarily representative, but the direction should still give us a good indicator. Still at 12.7% positivity. As a reminder, in early June, we were just above 4%, so we're still more than triple that, but at least it is now coming down. And now for our most updated indicator, percentage of all emergency department visits with diagnosed COVID-19 in the United States. And this graph is showing us through September 29th. So that's great. That really is just a few days old. The latest peak you see there was late August. So it's great to see this coming down like this, basically for all of the month of September. And what we want to see is this to continue to come down. And importantly, we would like to see this followed by a decrease in hospitalizations and deaths. And we do finally see a very slight decrease the week ending September 23rd compared to the week before that in hospitalizations for or with COVID. So it's just barely creeping down, but this is the second week in a row of creeping down since being over 20,000 the week ending September 9th. So I'm going to stay cautiously optimistic here. But we still are at over 19,000 new hospital admissions the week ending September 23rd. This is more than triple what we were seeing for most of the month of June. So that is still a lot of people every week being admitted with or for COVID. So now I'm sharing the new look for the COVID data tracker, which I kind of like, so I thought I would share it with you here. So they've added essentially a couple of indicators here. The test positivity, which we just went over, that's coming down a little bit. Emergency department visits is coming down nicely. And then this is the part to the right that I've been showing every week. So showing the hospitalizations that we just talked about, slight decrease in the last week. And now taking a look at deaths, which unfortunately are continuing to increase. So what I was wanting to show here, and I kind of wish that over to the left here they had the wastewater, because then that would give us the whole continuum of early to later or more severe indicators in how we are tracking this pandemic. So first is wastewater. It's not here, but that's how we've been the order we've been looking at it in, and then followed by test positivity, emergency department visits, hospitalizations, and deaths. And this is the way we can kind of think of the sequencing of how we're going to be tracking any waves or increases that we're seeing with SARS-CoV-2. The week ending September 2nd, there were 1,008 deaths. That is up from 959 the week before. And it does look like they've gone up even further after that, but those data are incomplete. So we'll report back weekly on that. But so far, we're on track for 3,000 to 4,000 deaths for the month of September alone. So waiting for final numbers here, but clearly that is still significant and too much. And also, it's hard to get comfortable with the fact that just this past July, we got down as low as 473 deaths in 1 week, but we just couldn't hold it there. Ideally, we could have held steady or even kept going down, but we just didn't. At this point in the pandemic, where folks seem to want to declare victory and drop mitigations, how are we finding ourselves in a situation of over double the weekly deaths now compared to just a couple of months ago? So we really can't be saying that we've got things figured out. One day, if we can get to the point where hospitalizations and deaths do not increase with increases in cases, that will be great, but we're not there yet. This is partly because of underutilizing outpatient treatment like Paxlovid, which does significantly reduce those bad outcomes, but still COVID is kind of staying a little bit of a step ahead of us. As it relates to variants, right now, EG.5, which is one of the XBB family, was last forecasted at almost 30% of specimens, and HV.1 is now over 12%. Remember that despite all of these names, these actually are all still part of the XBB family. So we are still dealing with almost all XBB subvariants of Omicron, which is a good thing, especially since that is what the new booster is tuned against. And remember that the new booster doesn't have any of the old strains. Actually, all of the vaccines with the old strains have been deauthorized and discarded. So as it relates to variants, this is the no news is good news segment. Hopefully this will stay boring from here on out, but of course no guarantees of that, especially given the amount of transmission that is still being allowed to occur. Now, I have been getting a lot of questions about testing. People want to know if the home tests still work because we're all hearing stories about people testing negative for days, then later finding out that they really did have COVID. So what gives? Well, as it turns out, things have changed in terms of how we can think about or use home tests, but it's not because of the variants. So let me explain that first, and then I'll come back to what has changed. So we know that we have PCR tests and then we have antigen tests. The PCR tests are the definitive ones that you can get at the doctor's office or the pharmacy. They are the ones that are going to pick up COVID fairly early, and that is still the case. The PCR tests are actually under a lot of oversight and a lot of scrutiny, and they actually have been updated a few times so far during the pandemic, depending on what type of platform the test was using or what it was actually targeting. But in response to the new variants, there have been many that have had to be updated during this time. So these are highly regulated. These are things that are happening within laboratories. So as long as the specimen is collected properly, which it should be since it's being done by medical personnel, then a PCR test you can fairly well rely on. So if you have a place where you know you can get a PCR test, that is great. And that is going to be the best choice for certain people in certain situations. I'll get into that in a moment. But what about the antigen tests? So there are home antigen tests, but also there are many testing sites and pharmacies that are moving to antigen tests from PCR tests. So you would need to ask to know what it is you're getting. Now, as it relates to antigen tests, I'll take us back to this image of SARS-CoV-2, and I borrowed this image from the American Society of Microbiology. This is showing all the different parts of the SARS-CoV-2 virus. And spike protein is what we're most familiar with, and that is really the part of the virus that has been undergoing many, many mutations. So basically, the new variants that we've been dealing with are mostly due to mutations in the spike protein. And this is why we've had to update some of the PCR tests, like I mentioned, and also why we've had to update the vaccines, because those are also aimed at the spike protein. The N protein, or the nucleocapsid protein, you can see that's the protein kind of in the middle there. Now that has not changed a whole lot. So we say that it is pretty well conserved. So it hasn't changed much. And guess which part of the virus the antigen test is picking up? It is picking up the nucleocapsid protein, or the N protein. So the N protein really hasn't changed much. The antigen tests remain able to detect SARS-CoV-2. So that is the good news. And now for the rest of the news. But before I get to that, briefly, why do we need to test in the first place? There have been some takes that say, well, why test? Why don't you just stay home until you feel better? And I guess if you don't need treatment and you live alone and you can stay home for 10 days, then maybe that's something to consider. But frankly, I still don't like it, because then you'll never know what you had. And with the amount of long COVID and post-COVID events, I think it's far wiser to know what you have and to have it documented. As usual, I think knowledge is power, and it's better to know than to not know. But I think the main reasons that you need to test are, first, of course, if you need to be treated. And if you need to be treated, then you really need to know right away if what you have is COVID or not. And also, many of the same people who should be treated for COVID might also benefit from outpatient flu treatment. So basically, if you have underlying conditions that put you at risk of a bad outcome from flu or COVID, then you'd want to know what you have as soon as possible so you could act accordingly. Second reason, not to spread it to others. We know that COVID spreads a lot faster to a lot more people than basically any other respiratory transmitted virus that we are dealing with. So you need to know if what you have is COVID so that you can protect others around you. And third, I would say to test out of isolation. So these are the main reasons why we're wanting to do antigen tests in order to know how to act, basically, but also we can use them as a layer of protection when we're doing events. I highly recommend that. But we know that that's not definitive and it's not something to be used alone. So really, the main reasons why we're worried about these tests or why we need to test is to be treated and to not spread it to others. So how helpful are COVID tests with all of this? The home tests for all of this, or the antigen test? So there are two studies that I think give us great insight into this. The first one I already went over in the July 11th briefing. I went over this study in detail. And basically what this study showed was that the home tests were most helpful for those who had symptoms and most helpful when you repeated it 3 times. So specifically for those with symptoms, a single test was 82.5% sensitive. 2 tests were 93.4% sensitive. And these were 48 hours apart. And then 3 tests, and again, 48 hours apart, the sensitivity went up to 94.3%. So remember, sensitivity has to do with the test correctly identifying a positive result. So if you have symptoms and you repeat the test 3 times, the sensitivity or the ability to pick up that positive is very high at over 94%. So that is good. However, what that study also showed is that without symptoms, if you did the same thing, 3 tests every 48 hours, the sensitivity was less than 70%. So not so great, but definitely better than not testing at all. So basically, serial testing or repeat testing is going to improve the sensitivity either way, but particularly if you have symptoms, you will need to repeat test, and then I think you can feel fairly comfortable that if by day 6 and on your 3rd test, you're still negative, you probably had something else. And of course, this is with the caveat that you are collecting a good specimen. And at this point, although the packaging doesn't say so, a lot of folks, including whole other countries, are recommending that you swab the throat and then the nose. But if you want the details on that test, I linked the prior briefing in the post, so you can check that out, and also the articles linked in the post. But today I wanted to review this article, which just came out on September 28th. The new normal delayed peak SARS-CoV-2 viral loads relative to symptom onset and implications for COVID-19 testing programs. I don't know if I want to say this is the new normal. This just seems to be the current state of affairs. So this study looked at 348 people who were newly diagnosed with SARS-CoV-2 by PCR. 91% of these people were either vaccinated, previously infected, or both. And they looked at both the PCR and at antigen concentration measurements and found out that from the day of symptoms, the viral load started kind of going up from there and not peaking until the 4th or 5th day. So on day 1 of symptoms, the viral copies were low and the antigen tests were only 30 to 60% sensitive. So not very good. And so remember early in the pandemic, we were saying day 1 of symptoms, you should be able to get a positive test. This was earlier on kind of really, frankly, before we had great access to antigen tests, but at least that's what some of the studies were showing us, is that they were picking things up early on. Now here by the 3rd day, it was 59% to 75% sensitivity. So that's an estimate, but still missing quite a bit. So you're missing like 3 out of 5, 1 out of 4. And it wasn't until the 4th day that the antigen tests were finally estimated to be 80 to 93.3% sensitive. And again, this is different from earlier on in the pandemic. And this is really speaking to the fact that you can't really expect these home antigen tests, or really any antigen test, to be positive until day 4 or 5, because before that, you're missing quite a bit. And kind of a side thing in this study, they also looked at 74 patients who had tested positive for flu by PCR, and they noted that the flu viral loads peaked like the day after the first day of symptoms, so much sooner. So you'll pick up the flu perhaps the day after you start symptoms, but you might miss COVID. So essentially, what this is saying is we should really not expect the antigen test to turn positive until day 4 or 5. So this is a problem if you're someone who should be treated. Because remember, if you don't test positive on time, you can't get treated on time. And most of the treatments must be started within 5 days, and the sooner the better, really. And here is the chart of our current outpatient SARS-CoV-2 treatments. Paxlovid, still considered first line, and everyone 12 and up who doesn't have a reason why they can't take it, this would be first line for them. We know there are some people who are on medications that will make it difficult or not possible to take Paxlovid. It's really a pretty small number of people who fall into this, but there certainly are people who fall into this. And if you're one of those people, remdesivir is an excellent second line treatment. The problem with remdesivir is that it's IV 3 days in a row. And ever since the ending of the emergency declaration, we're having a tough time finding out where we can send patients to receive remdesivir. But if you know that you're in this category of people, you really should get a plan with your physician of where you're going to get remdesivir if you absolutely cannot have Paxlovid. And I really wouldn't settle with the third line molnupiravir unless you really absolutely have no other choice. We mostly want you to get either Paxlovid or remdesivir. And if you are someone who is severely immunocompromised, you might be eligible for high titer convalescent plasma. But again, you're going to have to plan ahead. So I've been saying this, yes, for years now. You need to have a plan ahead of time if you're someone who should be treated. The list of folks who should consider treatment or the conditions for which you should be considering treatment is linked in the post. There are a lot of underlying conditions that actually qualify you for treatment. If you're 50 years and up or have any of these underlying conditions, please get a plan with your primary care physician. And if you don't have a primary care physician, please get one. So back to testing. So what are you going to do if you're testing negative? It's now day 3 of symptoms, day 4. You're a high-risk person who needs to be treated. What are you going to do? So if possible, you really should be trying to get that definitive PCR test. And this is why I've also been saying that it's important that you reach out to your doctor and find out if they are conducting these tests at their office. And every primary care doctor does swabs that get sent off to the lab for various things, and COVID is one of those things, flu, RSV, or others. But if you can get this done day 2 or day 3 after your symptoms start, then this should give you time to get treated. And even better would be if you have the prescription just waiting for you at the pharmacy in the event that it does turn positive. I know that our systems are not working this way yet. This is really where things need to go. And this is what I think everyone should really advocate for themselves or their loved ones. And now remember that the reason why PCR tests can pick things up much earlier than the antigen test is because PCR actually uses a method to basically amplify or kind of replicate what's in the specimen. So even a smaller amount, like what we might find in those earlier first few days of symptoms, will show up positive. And so what if you don't have access to the PCR, but you really need to get this right because you're someone at risk of a bad outcome? Well, in this case, well, you should have access to the PCR test. So I'm just going to say that again. But frustratingly, we know that not everyone does. So I'll briefly say there's possibly another potential option. It's a little bit pricey, but that is the home molecular test. And this is something your insurance may reimburse you if you purchase it. So this uses kind of a similar method to the PCR, where it is doing some amplification of the material that's in that specimen for a higher sensitivity than the way that the antigen tests work. And these are going to be much more sensitive than antigen, and it's going to be able to pick things up earlier on as well. I'm not here to promote any specific brand, but the home test that I've seen most widely available is called Lucira. It's battery operated. It's able to do this amplification process, takes about 30 minutes, and it is going to do a better job at picking things up sooner than that antigen test. They even make one that is a combination flu and COVID, which is nice, especially if you're one of those people who are at risk of a bad outcome from flu also, because maybe you'd want to get treated for flu if that is the case. But certainly, if you're someone who should be treated for COVID, this is going to give you results sooner than an antigen test, but it is pricey, and they look like they're kind of going between $30 and $60 each online. But if you've got to get it right, we're talking about possible life or death situation. If you're trying to avoid being one of those 20,000 people per week or so that's being hospitalized still with COVID, 3,000 to 4,000 deaths per month in the United States from COVID, this might be something to consider. I really wish that people would not have to come out of pocket for purchasing tests or having access to tests, but we see that access is diminishing by the day. In some good news, the free antigen test program has been resumed by the federal government. So please do go ahead and get those free antigen tests to have them on standby. But know that if you need to get it right, if you're going to need to start antivirals within 5 days, you really might need to get that PCR or maybe the molecular home test, because the antigen test might not even turn positive until day 4 or day 5, as I reviewed in that study. So now, what about if you're someone who doesn't need to be treated? Well, in that case, it might not be such a bad strategy to just keep repeating the antigen test every 48 hours. You're hopefully going to be staying home, resting, recuperating, isolating, and testing every 48 hours. And if you're testing negative still by day 6 or 7, and you're on your third negative test, and you've been collecting it properly, then the chances are maybe you did have something else. So again, this isn't 100%, but it is in the 90, 93, 94% range effective. And I cannot emphasize this enough, but during that time, you should be resting probably, but you should be isolating. You should basically assume that you have COVID and do what you can to protect others around you from catching it. I mean, we don't want you spreading flu or RSV or anything else either, but we know that COVID is much more unpredictable. You can spread it to far more people than those other viruses, and the outcomes can be more severe. We can't always predict for whom they are going to be so severe. So with the uncertainty with COVID, not to mention long COVID and post-COVID events, you really should keep it to yourself. So wear a well-fitting N95 mask. This is considered source control. This is something you would want to keep on and stay away from others, avoid public spaces. I wish everyone just had all the sick time that they needed to just stay home and fully recuperate. But if you absolutely have to go around someone else, a tightly sealed N95 mask, tests right before you do go around anyone else. If you're negative and you wear that well-sealed N95 mask as source control, then at least you're reducing the risk. And please just completely avoid people who you know are vulnerable. And a friendly reminder that you really don't know who's vulnerable, who all is vulnerable just by looking at them. You don't. But definitely for the people you know in your life, or that you might be going around where you know that they're elder or that they have underlying conditions, really just please stay away until this whole thing is resolved. And last but not least, if you are testing positive, then another good use of those antigen tests is to test negative before you go back around others. Remember, enough virus to detect is enough to infect. Unfortunately, the opposite is not true. So we can see, and I think we know, but I just walked through a bunch of the evidence that shows that you can be contagious and still be testing negative. So as always, the antigen tests are helpful when they're positive. When they're negative, there are a number of different considerations that I just reviewed, but namely day 4 or day 5 of the symptoms is the most likely time you'll be able to test positive with the antigen test. Repeating it at least 3 times, basically between day 2 and day 7 or so, is going to give you the best chance of picking it up as well. And of course, if you're positive on that first or second test, you of course do not need to keep repeating it. If it's positive, it's positive. But lastly, if you're still coming up negative and the clock is ticking on being able to access timely treatment, go ahead and get that PCR or perhaps that molecular test for home use. So in summary, we are seeing signs of our late summer wave coming down, percent positivities coming down, emergency department visits are coming down. Now, for the first time in a few months, we've got 2 weeks in a row with hospitalizations slightly coming down. Hopefully, we're going to see deaths come down next. The best tools we have as far as preventing those bad outcomes remain vaccine and treatment, outpatient treatment, timely outpatient treatment. We now have the monovalent mRNA boosters approved. These are tuned to the current variants and they are becoming available now. And in the meantime, let's keep up our best practices to prevent the spread of COVID-19, prevent outbreaks. No one layer is foolproof, so we want to implement layers of protection. Stay up to date on your vaccination, wear high quality filtration masks like an N95, KN95, or KF94, especially indoors with others, especially if you are mixing with members of the public. Monitor and improve indoor ventilation and filtration. Whenever possible, gather outside. Outdoors is almost always safer than indoors. And remember, even if you've had COVID once, it is best not to get it a second time. You had it twice, avoid getting it a third time, and so on. There is mounting evidence of cumulative effects of repeat infection. And it doesn't seem like there's any limit to the number of times you can catch COVID. And we are also seeing a lot of post-COVID impacts. These can be on any organ system. We're seeing new onset diabetes, worsening asthma, we're seeing blood clots and heart attacks and strokes. We're seeing increasing burden of neurological issues. And these could happen after the first infection, but it might not happen until after the second or after the third. So catching COVID once and doing fine is not a guarantee about the next time. Sometimes that repeat infection can be more severe, even in the acute phase. Sometimes it can be worse in the longer term, and every infection is a new opportunity, perhaps even a compounded opportunity for long COVID and post-COVID impacts. So if you don't feel well, please stay home and rest, get tested so you can make appropriate plan to either get treated, but also to not spread it to others. And if you do come up positive, please test negative before you go back around others. And please, if you do not have a primary care provider, please get one. Know how to reach them before you need them. Remember to eat a balanced diet. Let's incorporate some fresh vegetables and fruits and avoid those sugary drinks. Consider a multivitamin supplement. Get some regular physical activity. Unless you're sick, then you're getting your rest. And please make sure you know about your baseline blood pressure, your baseline labs. Get those checked. Get your sugar, your cholesterol, your liver, your kidney functions checked. See if you have anemia, see if you're deficient in vitamin D, and get those things taken care of. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.